Good morning. Thank you for joining us to mark the launch of the World Health Organization's new guideline on the prevention of female genital mutilation and the clinical management of its complications. We are here today because the lives, the health, and the dignity of millions of girls demand our attention and our action. Female genital mutilation, FGM, affects more than 230 million women and girls alive today. Behind this staggering number are individuals, each with a name, a voice, and a future. Individuals whose rights were denied the moment a blade was taken to their bodies, often without consent, without information, and without any possibility of choice. FGM is not a cultural practice. It is a public health emergency. It is a human rights violation. And it is a medical crisis, one that inflicts lasting trauma and suffering, both physically and emotionally, across a woman's entire life course. The health consequences are well documented and devastating, from chronic pain and infection to complications in childbirth, psychological trauma, and even death. These are not isolated outcomes. They are predictable, preventable, and entirely without medical justification. There is no health benefit, not now, not ever. The cost to health systems is immense, $1.4 billion annually, but the cost to a girl's future is incalculable. And while we have seen progress, while some countries have turned the tide, in many places, FGM remains deeply entrenched, woven into the fabric of tradition and reinforced by silence, fear, and misinformation. This is why this new WHO guideline is so vital, because we cannot fight a practice this entrenched with fragmented responses. We need coordinated, multi-sectoral, rights-based action, and the health sector must lead. Health workers are at the front lines. Especially in primary care, they operate at the intersection between health systems and communities. They are not only caregivers, they are trusted messengers, educators, and often the first and sometimes the only source of support for women and girls who have been cut or are at risk. This guideline speaks directly to their role. It offers clear, evidence-based recommendations on how to prevent the medicalization of FGM, how to manage complications with compassion and clinical excellence, and how to train and equip health workers to recognize, respond, and advocate. But the health system cannot do it alone. We have to forge strong linkages with educators, legal systems, religious and traditional leaders, and most importantly, community-based organizations, especially those led by women and survivors themselves. Their leadership is indispensable, and we must listen, we must partner, but we must also lead because culture is not static and neither is harm. Practices once accepted can and must be challenged when the evidence is clear, when the voices of survivors are loud, and when the collective will is strong. WHO is proud to launch this guideline today, not just as a technical resource, but as a moral imperative. It outlines a pathway forward, rooted in prevention, grounded in care, and committed to the full realization of girls' rights. We know what needs to be done. The question is whether we will act boldly and together to do it. Can we please commit to a future where no girl has to fear the blade? A future where every woman has access to care and respect. A future where tradition is never used as justification for pain. It's time for us to do what is right and to end FGM. And I hope the guidelines help. Thank you.